when I first see a couple with infertility, I think it's very important to listen hard and not talk too much initially. Most patients will give you the answer themselves if you allow them to talk. Having said that, it is important to go back sometimes to the very first period, especially in my practice where I see a lot of endometriosis patients, to see what was that very first period like. Was it painful? Did the teenage woman or teenage girl take time off school? Did she later take time off work? And they're little clues that can then lead to more questioning if necessary about, do they have painful periods, heavy periods? Do the periods ruin their life? Do they have painful intercourse, for example? And I think endometriosis is certainly an underdiagnosed disease. So I think it's really a fact-finding mission, allowing the female patient especially to talk, and then making sure that all of the tests that supposedly have been done by the GP, including a sperm count, have been done. And I think I do give them direction. We get a plan of action, both for the female and for the male. And so the next step is when I see them again, usually it's to see if they're ovulating. Often it's to discuss the sperm count, whether it be normal or not normal. Sometimes to discuss an abnormal AMH result, the anti-Mullerian hormone result. So it's, the first visit really sort of sets the scene for what might happen in the next visit, and that may be not much at all, or it might be a laparoscopy for endometriosis, or if the sperm count is terribly abnormal, it may be direct to an IVF cycle. I'm one of a dwindling few gynecologists who really see the patients initially, work through their infertility story, perform a laparoscopy if necessary, and then however they achieve a pregnancy, be it IVF or naturally, can still deliver the baby. So I'm sort of looking after them from the word go till the end. And I've got a great job because I see ladies, I see their husbands, I get to see them make embryos, I get to see those embryos go back into the uterus, develop into babies. I get to be the first person to scan that little fetal heart, and I get to be the person who follows it through the pregnancy and delivers the baby. That's pretty good.